Hello and welcome back. Today we're going to simplify wound dressing selection using two key principles: moisture balance and antimicrobial use. If you understand these two concepts, dressing selection becomes much more systematic and less overwhelming. Let's break it down. Moisture is everything. Wounds heal best in a moist environment, not too wet and not too dry. Think of it like this: too dry, the wound bed cracks, cells can't migrate properly, and healing slows. Too wet, the surrounding skin macerates, tissue breaks down, and bacterial burden increases. Our goal is simple: maintain optimal moisture balance to support healing. So, dressing selection should always start with one question: how much exudate is present? If a wound is dry or has minimal drainage, we need to add moisture. These wounds benefit from hydrogels, films, acrylic dressings, and non-adherent contact layers. Hydrogels donate moisture directly to the wound bed. Films and acrylic help maintain hydration while protecting the surface. Non-adherent contact layers protect fragile tissue and prevent trauma during dressing changes. If a wound is dry and we put a highly absorbent dressing on it, we can actually delay healing. Dry wounds need hydration, not absorption. Next, if the wound has moderate drainage, the goals shift. Now we're not adding moisture, we're maintaining balance. This is where dressings like hydrocolloids or hydrophilic dressings are helpful. These dressings absorb some fluid while still maintaining a moist healing environment. This is often the sweet spot for granulating wounds. The key is matching absorbency to the output. Too little absorbency leads to maceration, and too much leads to desiccation. If drainage increases to moderate or heavy, we need to absorb moisture effectively. Options include foams, alginates, gelling fibers, and superabsorbent pads. Foams provide cushion and absorption. Alginates and gelling fibers are excellent for higher fluid levels as they transform into a gel and help manage exudate effectively. Superabsorbents are ideal when fluid output is high and ongoing. In these cases, our focus is on fluid control to protect the peri-wound skin to prevent breakdown. Now, to properly manage exudate, we also have to look at antimicrobials. Not every wound needs an antimicrobial dressing. They should only be used when there is clinical signs of increased bacterial burden or local infection. Common topical antimicrobials include silver, iodine, honey, PHMB, chlorhexidine, and gentian violet. Each works differently, but the goal is the same: reduce bacterial load and allow the body to heal. But here's how antimicrobials and exudate levels go hand in hand. Antimicrobial dressings come in multiple forms. They're not just a standalone product, so they're available as nonstick contact layers, foams, alginates, and gelling fibers. So when choosing an antimicrobial dressing, you must still match it to the moisture level. For example, if you have a heavy draining wound with a local infection, a silver foam or a silver alginate may be appropriate. But if the wound is dry and showing signs of local infection, you may want to use a nonstick contact layer. That's why we always match moisture needs and antimicrobials together. Now, I'm going to touch base quickly on odor and pain management because there are dressings that are special for these specific symptoms. For odor, charcoal dressings can help reduce odor associated with bacterial activity. For pain, some foam dressings are impregnated with ibuprofen to help reduce the wound-related pain. So here's the framework. Step 1, assess exudate level. Step 2, choose absorbency level. Step 3, assess for signs of infection. And step 4, only add antimicrobials if clinically indicated. When we match the dressing to the wound's needs, we protect surrounding skin, support granulation, reduce complications, and optimize healing outcomes. Now that we've reviewed the principles, I'm going to show you a visual guide that brings this all together. This chart maps exudate levels, appropriate dressing categories, common antimicrobials, and the different delivery forms available. It's used as a quick reference guide, but always base decisions on a full clinical assessment. If you're looking for clear, practical wound education with visual guides just like the one you saw here today, I invite you to explore my new book. It's designed to simplify complex wound care and provide easy to follow clinical visuals you can apply right away. You can download your copy at thewoundconsultant.com.
Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations,
Access to high quality supplements, holistic healing,
digital resources, informative books, or high quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.